welcome to the Friday, September 17th edition of the SVG-TV News. I am Khalil Kato with the details. A 56-year-old female is the second person to die this week from COVID-19 here in SVG. This brings the number of COVID-19 related deaths thus far to 14. A news release from the National Emergency Organization, NEMO, said the latest victim, who was unvaccinated, had pre-existing conditions and died at the Argyle Isolation Facility on September 15th from COVID-19 pneumonia. The patient reportedly tested positive for COVID-19 on September 9th after presenting with symptoms typical of COVID-19 and was admitted to the Argyle Isolation Facility on September 10th. Meanwhile, 54 new COVID-19 cases were reported from 338 samples processed on Wednesday, resulting in a positivity rate of 15.97%. NEMO also noted in the news release that 11 patients have been admitted for COVID-19 at the Argyle Isolation Facility. 2 are unstable. It was pointed out that all of the patients are unvaccinated. 321 cases are currently active, 2,667 cases and 2,332 recoveries have been reported in SVG since March 2020. NEMO said in view of the confirmed presence of the Mu, Delta, and Gamma variants in the country and the significant increase in the number of new infections, transmissions, severe COVID-19 disease, and deaths, strict enforcement and compliance with all protocols and recommendations by everyone is strongly recommended. NEMO also noted that the correct and consistent use of masks, avoidance of crowds, physical distancing, proper hand sanitizing, and immunization with available vaccines have all been proven to significantly reduce the risk of being infected, getting sick, or dying from the COVID-19 virus. And with 3 variants of COVID-19 present in SVG, medical practitioner Dr. Malcolm Grant says this could be a possible reason for the spike in cases. Speaking on a recent program on VC3, Dr. Grant explains the difference between the variants and how easily they can be spread.
But the Delta is as contagious as chickenpox. And the average person who's been infected with the Delta is going to infect 5 to 6 others, which is much more, many more than the original novel coronaviruses. As a result, it tends to spread more easily because it binds, it has a much greater affinity for the receptors, the ACE2 receptors, especially in the upper respiratory tract. It tends to make people sicker. It tends to, interestingly, attack the young. A lot of under 40s, a lot of children, which wasn't necessarily the case with the original coronavirus.
Dr. Grant said the Delta variant has led to the hospitalization of more children and even death.
And as a result, a lot more young people are ending up in hospital and even dying from it. In neighboring islands, we had last week a 28-year-old St. Lucian lady who died, and in Grenada, we've had a few young people under the age of 30 who have actually died from the coronavirus, and we strongly suspect the Delta. The Mu and the Lambda are variants of interest, but looking at their patterns and looking at where places that they've been found before, they do not seem to become the dominant strain. The Delta is by far the most dominant strain worldwide at this point in time.
The medical practitioner further noted that though vaccinated persons can still contract COVID-19, it is still highly recommended as it gives the best fighting chance against the virus.
The other thing with the Delta, you're much more likely to get breakthrough infections. It's in people who are vaccinated. Vaccines are still highly recommended because it gives us our best fighting chance to keep the Delta at bay. But in a small percentage of individuals who are vaccinated, it's very small, the percentage, you do get breakthrough infections. And very, very unfortunately, in an even, smaller percentage, you do get a few deaths. And this occurs generally in immune compromise, which can be either as a result of disease or medication.
Leader of the opposition, Dr. Godwin Friday, has noted with concern the uptick in COVID-19 cases in SVG and that it has now reached a crisis stage and must be treated with urgency. Speaking at a news conference today on the active cases, which have gone past 300, Dr. Friday said that people must make informed decisions on the vaccines, which he said at this time seemed to be a sure way of coming out of the pandemic.
Inform yourself about the pros and cons of vaccination and decide for yourself. No one will force you to take it or can. That's what I stood up against. But we all have an obligation to inform ourselves about it. I did, and I chose to be vaccinated because I believe it is the fastest and the safest way for us to get out of this problem of the pandemic. It is up to you to decide for yourself. The reports make it clear that the information is out there, so make yourself get it accessible and inform yourself and decide on this important issue. It makes it clear as well, the information that we've seen, that combating COVID has become even more difficult with the several variants that have emerged and have actually been found here in St. Vincent and the Grenadines.
Dr. Friday said disregarding or minimizing the threat of COVID-19 doesn't do any good, and that everyone should make a concerted effort to follow all the protocols, especially now that 3 variants have been recorded.
We know what we must do. So let us all do it. Wear a mask in public. Not sometimes, all the time. Especially when you are in those spaces. Wash your hands regularly. We know these things, but we get a little relaxed about them. But you can see when you relax what happens. COVID-19 virus spreads more rapidly. Social distance wherever possible. That is something that we have been practicing, but again, we get relaxed about it. In some places, it seems evident that it's being done. In other cases, it is not. And if we don't do it universally and regularly, then we really are exposing ourselves to great danger.
Outspoken former head of the SVG Christian Council, the Reverend Adolph Davis, says that people, including leaders, have lost the ability to engage each other and respectfully disagree on issues. Reverend Davis made the comments while speaking to SVG-TV News on the issues surrounding vaccinations, which he said are not confined to this country.
Kind of engagement that is not littered with venom and hate and bile and bitterness. We see, and not just St. Vincent. That's why I say I have had a problem with the language. Because all over, I'm watching California, and I saw some news clips from there, and I said, but this looks like St. Vincent, with nurses protesting and people talking about mandatory and no mandatory and all of that. And the biggest problem I have on it is our inability to have respectful, mature disagreement. I don't expect everybody will see it the same way. I don't expect everybody will agree. Some will think the mandatory is right and they will have their good views. Some will think it's wrong and they will have their good views. Some will say the way it was approached is wrong. Some will say the way it was approached is necessary. All kinds of views. For me, the biggest part of it is how could we respectfully engage and disagree. And I think because we are not able to do that, and that's part of the political landscape, we can't talk properly about issues in St. Vincent because immediately it's colored politically and I write you off because I think you are, and how could you?
Reverend Davis, who is currently on 3-month sabbatical leave before leaving for Trinidad and Tobago, said that an amicable solution is needed to deal with the vexing issue of vaccinations, which he said seems to have divided some people.
I think if we could find that space to properly engage, I think we will be able to have a responsible discussion nationally in the corners and so forth. and we may be able to come up with better solutions. Because, frankly speaking, some of this is not new. I've said some of the attitudes and behaviors regarding COVID and the vaccine, it's really not new. Experimental drugs is not new. New drugs is not new. People encouraging you to take drugs is not new. In fact, I tell people all the time, I've heard people get so upset if they hear somebody say you should take the vaccine. Oh, we kind of minister and pastor and how they're wicked, and they will tell people. But we know we're in a culture where if you sneeze, somebody ready to give you a tablet. They don't even know if you're allergic to that. They tell you, take this bush. We have always been that kind of a people. But somehow on this matter, the passion and the venom and the anger, and we can't disagree without it being personal. And I think if we could take it away from that, I think we will be in a better place.
As it relates to rights and freedoms, Reverend Davis said persons should not be selfish, as it could destroy one another.
We like to talk now about democracy and about freedom and about rights. I hear all of that stuff. But I've always seasoned that language with God's word. Because I don't think a right is a wrong. I can't claim rights for wrong. I can't claim freedom for wrong. You know, this society has never functioned like that. In other words, the more we become singularly invested in being selfish people, we're going to destroy our world. In any country, we could work together without collaboration, cooperation, compromise. We have to be able to compromise. But if everybody is going to say, my right, my right, my right, we're going to destroy our society. And that's not Caribbean language. Caribbean people have generally been a very communal, social people. And I think if we lose that, we will see we destroy our destroying of our society without realizing it. And I think it has to do with everything. More and more, we have to become more appreciative of and respectful of the next person.
In light of the increase in COVID-19 infections, visits to Her Majesty's prisons have been suspended until further notice. The announcement was made in a news release from the prison superintendent, Timothy Hazelwood, who thanked the general public on behalf of himself and staff for the cooperation and continued support. Superintendent Hazelwood this afternoon told SVG-TV News that there is no outbreak of COVID-19 in the prisons and that they would like to keep it that way, hence the discontinuation of visits temporarily.
This is in keeping with the recent upsurge in COVID-19 infection throughout St. Vincent and the Grenadines. We are in the process of reorganizing our standard visiting operating procedures at the prisons in order to safeguard the prison's environment. However, we are mindful of the importance for inmates to see their families and friends, vice versa. We will do all in our powers to facilitate the general public and inmates as time goes along. At this time, the safety and health of the inmates and prison staff remains our main focus. Presently, we have no positive cases among our inmates and our prison staff.
In other news, the lead scientist monitoring the La Soufrière volcano said the volcano is much safer now than it was months ago. Dr. Thomas Christopher was at the time speaking on the reason for the change of the volcano alert level from orange to yellow.
I think that has a lot to do with the state of the volcano and what the perceived threat of the volcano is. Basically, I think that step down from orange to yellow suggests that, you know, the authorities and the scientific staff, you know, are of the opinion that, you know, the threat has been greatly reduced. So people living in these vulnerable areas are no longer at risk to at least primary hazards from the volcano. Of course, there's still some minor secondary hazards around, because you can get lahars if you get heavy rain and so forth. So, but I mean, in general, the activity and the level of risk has dropped significantly. So it's much safer now than it would have been. Or I think we're sure about saying it's safer now than it would have been maybe 2 or 3 months ago.
Giving an update on the recent activity at the volcano, Dr. Thomas said that things are more settled.
The activity is more or less the same that has been the case for the last month or two. We had one very small earthquake, I think it was on Tuesday, and it was only detected on the Walibu station. So it gives you an idea of how small it is, or was rather. Took a measurement yesterday. I haven't processed it yet. Hopefully I'll do that over the next hour or two. But it was a struggle to smell the gas. It wasn't that strong. It wasn't really overwhelming as it would have been in April or May. So, I mean, all of that more or less points to the fact that the activity is falling away and things are settling down.
The new academic year is scheduled to start on October 4th. However, Minister of Education Curtis King said that the ministry is unable to say what format will be used for teaching. On radio this week, the Education Minister said that the format will be determined by the country's COVID-19 rate of infection.
Is that school is scheduled to be open on the 4th of October. And we in the Ministry of Education, we are working towards that date. What we cannot tell you is the format in which the schools will be reopened. There has been a spike in the number of active cases of COVID-19. And we move, if you like, from a situation where we had less than 20 active cases to today, earlier today, the figure was 269. That obviously have implications for the format in which school will be reopened.
Minister King noted that the new school year can start using 3 formats: a blended approach, face-to-face teaching, or online classes.
In this COVID-19 pandemic period, where online teaching has become part of the daily discourse, when we talk about reopening of school or the opening of school, we have to make the distinction that, look, school can be open in several formats. It could be open with a blended format, that is to say, some online, some face-to-face. You can have face-to-face only, and you can have online only. So see how the discourse is changing.
Meanwhile, Minister King continues to encourage citizens to get vaccinated. He said adults have a responsibility to ensure the children return to their classrooms for learning, and this can be achieved if the vaccination or rate of infections improve. The Education Minister said despite the efforts at online instruction, it is not a great substitute for face-to-face teaching, noting that some students have experienced a great learning loss as a result of this method.
In fact, even now, the ministry and the schools are working on a recovery program that I believe would run over a couple of years to try to recover some of this learning loss. I'm saying all this to say, for our students to return to online instruction again, for our students to be out of school, out of face-to-face instruction again, it is going to continue to impact on them in a negative manner.
Minister King further explained what he means by learning loss and how the children were impacted in the last school year.
About academic learning loss. But don't forget, there's the other important aspect. Our education, what we design was the all-round development of the child. So, while it's true, the child is losing a great deal academically, we must not forget the psychosocial loss experienced by our children.
The Education Minister thanked teachers who made the effort and put together strategies to ensure that their students were able to excel through the online instruction.
The heroic, if I could put it that way, efforts of our teachers, some of them, I'd say most of them, but I don't want the minority of them who did not pull their weight to get away with me making a sweeping generalization. So I would always say, most of our teachers did in fact heroic work in terms of providing online instruction. A tiny minority that did not, I urge you to pull up your socks so that if it comes around again, that you would do better in this regard.
The artwork of primary and secondary school teachers are on display at the Yulu Art Center in Villa. The art exhibition, which opened to the public last week, is showcasing a variety of work which is not only for viewing but also to be purchased. Some of the teachers explained their works, which included paintings that tells a story about the people and places here in SVG.
So it's limitless, it represents limitless possibilities, so that's where the sky coming and the headdress is just all my emotions floating around. And the dress is because I like fabrics. I like the drama of fabrics, so that's where that is. And
I worked a lot too with ash from our last eruption because I wanted to just bring out, like I said, that whole essence of remembrance of the regretful for the things that we try to suppress.
Coming out from behind of her, it's like she's lusting for something. It could be whether it's for love or happiness or freedom. It doesn't just based on sexual emotions or what, it's based on what goes on around it.
This one was a challenge. It took years for me to start using color. I really love black and white. And when I did this one, I just wanted to jump into the world of color. And I wanted to use complementary colors to express the landscape. So instead of having your normal greens with your dashes of reds, I wanted to bring your reds with your dashes of blues or greens.
Regional Maritime Officer with the RSS, Lieutenant Rolrick Sobers, says that SVG is now in a better position to combat maritime crime, with new officers added to the Coast Guard service. Speaking at the recent graduation ceremony for 9 Coast Guard officers who completed the basic seamen's training with the RSS Coast Guard, Lieutenant Sobers said the RSS is ready to lend support and stressed the importance of countries in the region working together to tackle maritime crime.
You can then be in full view of combating those maritime crimes and threats that are very, very, very much present in our waterways, in your waterways, within the RSS region. And you're not in this fight alone. You have the other member states in your area, particularly Grenada to the south, St. Lucia to the north. Those are your closest neighbors. Barbados a little bit out on the east. But we're all here to work and support, and they will give you the necessary support, once you reach out.
The maritime officer noted that SVG is made up of many islands, which makes it even harder to patrol, hence the need for countries to work together to protect their respective borders.
In the coastal waters, which is equally, or matter of fact, which is more important, because you have a lot of small islands, bays and keys, and it could be fairly easy to run aground. And the cost of repairing a boat or replacing a boat these days is extraordinary. So you must take this whole business of seamanship, navigation and rule of the road very safe, very, very, very seriously. Helmsmanship and lookout duties, as I mentioned before, remain vigilant at all times and make sure that you attend to the safety of your team. Safety is also for me, it comes at the top of the table.